Okay, welcome to episode 58 of the Sean Beginners podcast. Today we have on good friend and clinical nutritionist, is that right?
Yes, that's right.
Tara. So Tara, give us a little rundown quickly about yourself, or what do you do?
What I do. So I have a bachelor degree in nutritional and dietetic medicine, which makes me a clinical nutritionist. So what that means for those of you who don't know is that I am trained in clinical nutritional medicine, and therefore I can not only work with, public health and general nutrition groups, but also with those of you who have health conditions or disorders. So I can help you with nutritional medicine treatment.
Yep, perfect. So today I think what we want to talk about is nutrient deficiencies, but obviously in terms of people that are unhealthy, but also people who are into their health as well, because obviously, as you know, you're not only in nutrition, but you've been around fat loss and stuff as well, which two different things, but you need to know both at the same time. So I think what we were discussing earlier was people that may go into a calorie deficit and you're losing weight, and okay, we know by simply if someone just loses weight, a lot of the health markers are going to go good.
Yeah, they're going to improve definitely with weight loss.
But there may be a certain stage where someone reaches certain nutritional deficiencies, and then that's going to impact on hormonal function, and then that might cause them to obviously develop the diseases or even stall through a number of ways. So we were just going to touch on kind of some of the most common ones you see, and then we can look at some ways someone could spot it, as well as obviously having a blood test. But some ways you go, okay, I actually have that. Because when someone's in a calorie deficit, they're restricting food, but when you restrict food, you're restricting nutrients as well.
Yeah, absolutely.
Let's start with, maybe we'll go 3 to 5. What are some of the most common ones that you see in your clinic testing people?
The 3 heavy hitters that I see in my clinical practice would be iron is a big one, vitamin D and zinc. They're probably the 3 most common.
Well, let's start at iron, especially, again, we can delve a whole topic in itself. People think they're healthy, cutting out meat, etc. That's it. We can touch on that as well, but obviously even more significant in women who have a menstrual cycle as well. So what are some of the key signs? It doesn't have to be anemia. Obviously, there's probably different along the spectrum. You might just be deficient and inadequate and stuff.
There's several stages of iron deficiency. You may not, in the early stages, iron insufficiency, you may not see any symptoms, or they might be really, really mild, and that could be attributed to something else that's going on in your life, like, circadian rhythm disruption or something like that. So the biggest thing with iron is fatigue and tiredness is really common. As we progress to iron deficiency and then down the track to more serious iron deficiency anemia, you're looking at paleness, breathlessness, changes to your heart rate, dizziness, poor immunity, weakness, feeling cold, cognitive disruption as well, physical signs like swollen tongue.
And this is even more pronounced than if you're training as well, because obviously a lot of the time you're going to be losing iron anyway.
For people that are training, athletes are at higher risk of iron deficiency, absolutely. And
so is it safe to say, like, I don't know if there's a percentage of women in general that have some kind of iron in that, so you put, but we can say, I've seen it a lot where I've trained women and they go, oh Sean, I'm just so tired all the time and this. And I say, okay, when's the last time we have a blood test? And they go and get it, and then like their iron's through the floor. And like some is very serious where they've needed infusions on the spot, etc. as well.
Yeah, I've had that myself in clinic where, clients have been not taking it seriously. Like your mild iron deficiency progresses to the point where, next minute they're being taken into hospital, prioritized for infusions. So iron is a huge one. It needs to be taken really seriously, especially by women, because as a female athlete, you're menstruating or you're trying to conceive, whatever your situation may be, you are at higher risk of iron deficiency.
And so some of the common symptoms, like you said, for even the inadequacy, again, which can tie into a lot of things, low in energy, like you said.
Well, I guess, yeah, fatigue and tiredness is the big one.
Yeah,
It's the most common one. And, you know, as soon as I address it with my female clients, the first feedback that I get is how much more energized they feel and how supplementation has made such a huge difference in just in terms of their energy levels. So in turn, that's going to improve your quality of life, you know, your performance, your training.
Yeah, because what obviously I'll see in terms of fat loss, someone's trying to cut their calories and say, Sean, I can't do any more steps, I can't train hard. Well, if this is the little thing that's holding you back, making you fatigued, you're going to struggle to burn calories, you're going to struggle in the gym.
Absolutely.
Like, you're just kind of
your NEAT's going to go down.
Yeah, everything will go down.
You just don't have the energy to keep pushing and to keep striving. And it's a vicious circle because you're going to cut more calories.
Yeah.
You're going to get even less of those micronutrients that you need to be able to carry out those things during the day.
Is it a case then if someone keeps doing it, obviously in conjunction with probably a mad calorie deficit, would that, if a woman becomes anemic, would they get to the stage where they lose their menstrual cycle? Is that one of the byproducts of someone with serious anemia? Or
yeah, that's also one of the byproducts of just being in too much of a calorie deficit. General, under eating, overtraining. Like, you know, it is a really fine balance with females, and it has to be managed differently with men. And, you know, that's why I also, my two areas that I specialize in are performance nutrition and women's health, because unfortunately it's just not managed very well for the most part.
And obviously, as we said, it made even worse these days where people cutting out meat, different for ethical purposes, that's fine, but when people think it's healthier to be vegan and kind of stuff like that and they cut out red meat, like what, apart from that, what are the other kind of most bioavailable foods containing iron that people could try to add in?
It's a tricky one because, you know, there's definitely more of a tendency towards a vegetarian style diet, and I also see that more often in my female clients. Some people definitely thrive on a vegetarian or vegan style diet, and I support that choice. For some people, it's really detrimental. So it's very individualized. Obviously, heme iron, which is found in animal products, especially red meat, is the most bioavailable. It is like readily absorbed and utilized by the body. So it's a really easy way to, you know, increase and maintain your iron stores.
Because that's a big thing people miss, where they go, okay, there's lots of X nutrient in this food, where then you go, well, it's your body can't absorb it as well as when you eat other foods. Like,
well, yeah, so there are plenty of, like, non-heme iron is present in both plant and animal products. It is much more common, much more abundant, but the problem is that it's not as easily absorbed, and there are things that you can do to make it more absorbable. But also the other thing to other thing to consider is if there's any kind of malabsorption picture going on. And that could be from a health condition, it could be just from poor dietary habits. So like, what time of day are you having your coffee? Just little things like that make a huge difference. Certain health conditions will influence how you're able to absorb and utilize iron as well. So that's another factor that you need to look at in conjunction with those things. So because again, that's the other things you might see, I don't know, vegan pages where they go, okay, there's much iron in spinach as red meat, and you're like, cool. But then, as you said, it's completely different how your body absorbs it. Yeah, the percentage of iron that your body is actually able to absorb and use is going to be much less in comparison to the red meat, unfortunately. So that's
and again, for people, your obviously first protocol will be get a blood test so we can see, because you may be at extreme inadequacies of iron, like, and there's no point you then taking the recommended dosage, because like you need way more to get you back up to normal levels starting off. Yeah, dosing protocols are a whole other ballgame. Unfortunately, I see some GPs just handing out the same old iron supplement and the same dosage to every single person, regardless of how progressed their deficiency is. And it's really frustrating to see, because it's different for each person. Also, you know, more recent research has shown that, you know, taking an iron supplement every single day is not as well absorbed as taking it perhaps every second day is actually much more efficient.
So they're not up to date with that research. And that's why when it comes to nutrient deficiencies, yeah, GPs are a great avenue to get your tests done, but they're not great for treating, well, interpreting those tests, definitely, treating and addressing those deficiencies. That's where you need a nutritionist or a dietitian.
Yeah.
That's what we do. That's our specialist area.
And then you don't even touch on, obviously, the type of supplements then people are giving out. Like, most standard ones are absolute garbage.
Yep.
Probably the majority, I assume, except for a few like pharmaceutically made ones.
Yeah, so we give out practitioner grade supplements, so we have to supply you with a prescription for you to be able to access them. You can't just go and buy them over the counter. So I have like a patient portal that I'll send out my patients their link with what they're allowed to buy, what their dosage is, and that's the only way that they can access their supplements. And again, those supplements, they are more expensive, but that's because you're getting like higher bioavailability in those supplements. They haven't taken shortcuts with ingredients. Like,
well, supplement companies are trying to take the piss as well, where they say, okay, there's this zinc in this, and it, but again, it's not the one your body can absorb well.
Yeah,
so they're just trying to save money.
The compounds are shit. It's just not the same. Like, you know, it's like, I liken it to when you buy your skincare products. You know, I have a lot of female clients, and so, you know, if you go and buy a $5 moisturizing cream from Kohl's, you're not going to expect it to work wonders. You're not going to see a reduction in your fine lines and all that sort of stuff that we want from our skincare. Your supplements are no different. You know, if you've got iron deficiency anemia and you're just taking, you know, an over-the-counter supplement that your doctor gave you at the same dose that he gives out to everyone, well, you're not going to get results. Yeah. So you need to invest if you want results.
Yeah. Iron, and then, so in terms of athletes then, obviously, as well, which probably is not as well known, iron's a lot of the time associated more with females and female health as well. So male athletes as well, obviously you're training females as well, they lose more for exercise. Tell us the same kind of protocol as well. Get tested, see where you're at.
Yeah, iron, always get tested. I will not supplement someone for iron unless I have their test results in front of me. And make sure that you get tested properly. This is the other problem that I see with GPs, is that they're only testing serum iron. They're not doing the full iron panel, and that's really important because it gives us a much clearer idea of, and it's the only way to get an accurate idea, really, of where you're at and if you are iron deficient, so how progressed it is.
Is that the one covered under Medicare, obviously in Australia, or you can get the full?
Yep, iron studies are covered under Medicare as far as I'm aware. Yep. So the iron studies will include serum iron, transferrin, ferritin, and what was the last one?
Sorry, I'll come back to it.
All right. Transferrin saturation is the last one.
And then, just as important, going back and then getting retested, and so how long would you say, okay, it would differ between everyone where you're going to take a supplement. I think Gordon Lacey was in a seminar before, and he said to everyone, like, put your hand up if you take supplements, and all trainers put the hand up. He's like, put your hand up if you get regularly retested to see if you're actually absorbing the supplements that you're taking. Otherwise, you're just guessing. You don't know what's going on.
Well, yeah, and those supplements serve a purpose. Like, you're not supposed to take them at that dose every day or every second day for the rest of your life. Yeah. You know, it serves a purpose, and once it's been addressed, you don't need to continue taking them. So it is really important that you get retested. How often you get retested, well, that depends on where you're at and how deficient you were. If it's something that's really severe, I'll want testing within 3 months.
Yeah.
Whereas other people might be fine with 6 months.
Because even, I think it was Dr. Bruce Ames, where people go, you know what, I don't need that supplements, this, that. And I think he talks about what's called the triage theory, where if you only have a little bit of your essential minerals and vitamins, your body will use that for the most essential thing, which would be to keep you alive. Mm-hmm. What then falls off is kind of, you could say, non-essential stuff, but that's more than going to likely lead to age-related diseases down the line, where you get cancers and kind of other kind of stuff, because your body has just used that stuff for the most. So again, magnesium, where you're going to use it so you don't die in that moment, but all the other kind of stuff down the line that's when it's going to hit you 10, 20 years.
And like, this is the thing with getting your test done is like, you know, if you go to the dentist every 6 months and you get your regular clean done, or, you know, you're up to date with your sexual health and you're always getting your screening done for your reproductive health as well. It's like, well, why aren't you also getting your bloods done to check your nutrient levels? Because that is just the most basic part of preventative healthcare, because yeah, these nutrient deficiencies can predispose you to chronic diseases down the track, you know, as serious as cancer in some studies have found. So, you know, why aren't you doing that? It is really important as part of your preventative healthcare routine.
Yeah, because I think when a lot of people think of like your essential minerals and vitamins, so to do one job where you're like, magnesium just associate, okay, you need that for sleep, I heard. But you're like, how many other hundreds of processes go down in the body that need that exact thing for it to work properly? And then obviously if you're not giving it, something's going to collapse down the line because you just haven't had that mineral or vitamin to do its job properly. Yeah,
and I mean, your lack of consumption or deficiency of a certain nutrient influences your ability to utilize and absorb other nutrients as well, and we get that flow-on effect. So yeah, like the sooner, if you stay on top of your bloods, the sooner we can identify it, the sooner we can fix it.
And obviously being a nutritionist, like when we talk in terms of these vitamins and minerals, not only saying, okay, you need to supplement, you probably first say, if, again, depending on dosage, if you can get it from food, even better, because
definitely
foods are going to have like the different, you can talk about minerals and vitamins that kind of act together. I don't know the name, what that's called.
Yeah, so you have, like, each time you eat a meal, you have a very complex nutrient matrix that's there. And, you know, that's why it's really important that we try and get things from diet first and foremost. And I really firmly believe that should be the case. But if your deficiency is too serious, it's progressed too long, then yeah, supplementation really needs to be considered.
That's both sides of it as well.
I
know some, talking about vegetarians and vegans, I think I've met one client, and she still trains me now in the past few years. She's the only one I know that gets tested regularly, and then you're like, okay, what you're lacking in this, you need to take all these various minerals and supplements, and she's on it.
That's great.
A lot of the time it's just, okay, I'm going to cut this out, and then I'm going to eat gluten-free this, and then carb-heavy foods here, and you're like, well, you're getting no nutrients and minerals. And then, I don't know if you've seen that thing, it's a vegan blogger, a vegetarian blogger, millions of followers, but someone took a video of her eating fish or something in a restaurant, and then she came out and said, well, look, my hair's falling out, my skin's a mess, all this kind of stuff, and your body's then craving these foods, and she had to actually add them back in. So again, what you're saying, if someone is going to choose to do that, they then need to do all the stuff associated with it.
Yeah, like I'm definitely supportive of, you know, clients who come to me and they're following a vegan or vegetarian style diet. Like I said, some people can absolutely thrive, and we definitely need more plant foods in our life, generally speaking. But what I ask of those clients is that they do keep on top of their bloods, and they do keep an open mind in terms of supplementation, or compromising somewhere and meeting me halfway, like eat a few eggs every now and then or something like that, because it's not worth your health deteriorating as a result.
And again, not going into too deep a hole, but a lot of the studies where they look at red meat, they're not dissociating like processed red meat, like your fucking sausage in a can versus...
Some of them are. There are a few that kind of differentiate the risks between processed red meats. So yeah, like sausage in a can sounds revolting, compared to, you know, fresh red meat. But yeah, there are some concerns there with the red meat. But again, what these studies fail to address is that every time you eat a meal, there's a complex nutrient matrix there, like we mentioned before. And, you know, if you're consuming that piece of red meat with, you know, your half a plate loaded full of vegetables, well, that is going to mitigate some of those potentially adverse, you know, it's not definite, but there is some concern there. Yeah, it's different for everyone.
Yeah, and generally, like, the studies where you can't dissociate the other lifestyle factors where you're looking at, right, generally if someone's eating red meat, where it could be a burger,
Yeah.
they're probably going to have a beer and a cigarette with that as well. So, you know,
Yeah.
generally, like, if someone's gone vegetarian, they're more health conscious as well. So that's the kind of, you need to take it with a pinch of salt. But yes, if you're going to do it plant-based, and then just get some protein. So in regards red meat, like, what if someone wants to hit the normal levels, adequate level guidelines, how many times per week
For red meat consumption? I say try not to go over like 500 grams per week of red meat. So again, that depends on how much red meat you eat in one sitting. So, you know, if you're sitting down to a 350 gram eye fillet, that could be, you might only have 1 or 2 serves of red meat for the week, and that's it. As a female, you might only have, 150 grams. So you can have a little bit more. Just make sure that, you are consuming it with adequate vegetables, complex carbohydrates, all the good stuff, so that we can, mitigate any of the concerns that are associated with red meat consumption.
Yeah. And again, it's ironic that people, I need to cut out red meat, don't sleep, drink 10 coffees a day, stress your ass, don't exercise, eat a horrible diet anyway. No worries, I need to cut out red meat.
If you cut out red meat, you're fine.
Yeah.
You got a whole pass.
So that's iron's the first. What would be kind of the second one did you touch on?
Zinc and vitamin D were my other two heavy hitters.
We can still tie into red meat as well. So, what are some of the signs and symptoms?
The first thing I noticed with zinc is usually changes to the fingernails or the skin. So white spots on the nails are a big one.
Yeah, I think there's a wives' tale between zinc, but I think people get mixed up with calcium as well, don't they? Like, with the white spots. So it's
white
zinc.
spots are zinc.
Yeah.
Changes to the skin as well. So like sometimes a similar appearance to eczema, but the difference being that with eczema, it can usually be treated by, topical agents. If it's not clearing up, then you might want to look at zinc. Hair loss or thinning, immune function is a big one as well. So if you're getting recurrent illnesses or infections, I'm going to start looking at zinc. Otherwise, lack of taste and smell, impotence in males, diarrhea, loss of appetite.
Zinc, another one, obviously covers like hundreds of processes in the body.
Yep.
And in terms of, if again referring to women, because again, if you're cutting out red meat, a lot of the time I'll see it from women clients more. You could say to them, look, you want good hair, good skin and good nails, like you need to sort your zinc levels out.
Yep.
And a lot of the hair and nail supplements have zinc in it anyway.
Yeah, but again, like if you're gonna supplement,
not saying, but that's a lot of all the hair, skin stuff. You'll have zinc.
Yeah, and I hear it all the time. Like, girls I meet, girls that I work with, and they're saying, "Oh yeah, I started taking zinc for my hair, or for my nails, or for my acne, Yeah, it's common. It's super common.
Well, that's a good little ground, right? If you're not going to take it for anything else, take it for that at least, because you spend enough on those things already.
Yeah.
And again, even more, if someone trains, athletes probably, I assume, I can't remember the statistic I've seen where how many athletes are zinc deficient as well, just because you use so much up when it comes to that. You're on your laptop and I'm having it up.
Yeah.
If we could pay for someone to pull this stuff up, I would, but maybe in the future. Sorry, we can put it up after. And that's equal amount between men and women. You'll see who kind of suffer with some kind of zinc inadequacy.
Yeah, it's pretty common in both my male and female clients. And it's one that people just really neglect to test as well. People don't bother to test it.
So it's in the normal blood panel you'll get, is it, zinc?
Yeah, well, I ask if you're testing your zinc, test your copper as well, because I want to make sure that ratio is where it should be. So, because
I've actually only had one client take too much zinc, but because he's a bit OCD, so I think the doctor told him to take 1 zinc per day to keep his levels in check, but he was taking 2 or 3, and he was actually getting like mad tingles in his fingers, and so it's a ratio to copper to zinc. So what's that ratio supposed to be? Or
I want it to be double copper.
So two copper to 1 zinc.
No, 2
All
zinc.
the way around, 2 zinc to 1 copper.
Yep.
Okay, yeah. And you never very rarely see people with skewing that ratio because they're eating too much copper containing foods. It's most likely because they're just not eating enough zinc containing foods. All right.
Yeah, or there's an issue going on that, for example, I have a patient with psoriasis, and that involves, a much higher turnover of the cells, and in those lesions, the zinc levels are much higher, which just means that, it's a case of demand exceeding availability. So that's the other thing.
Interesting. So there's conditions as well where it even puts your need for these minerals and vitamins up even more.
Yep. Yeah, definitely.
As well as just training, like we said, that's going to use a lot of these things, minerals and vitamins anyway, just because you're stressing your body out.
Yeah. And then, if you're in a calorie deficit as well, generally speaking, you're just getting less.
And what other kind of the main foods, the most bioavailable foods for zinc, especially ones that people may cut out again when they're trying to save calories?
So some of the great sources for zinc: oysters, meat, fish, pepitas, so pumpkin seeds, rolled oats are really good, chickpeas, almonds, cheeses. So
if I see someone's food diet, generally I'm going to see them probably not eat a lot of fish, especially oily fish, because it contains more calories. If we're looking at it, so you're like, well, okay, I'm going to save on that. I'm going to save on some red meat because I'm trying to save calories, and probably going low carb, so they're cutting out all their oats they're eating. Nuts the same way as well. So it takes a bit of a calculated approach for you to hit all these things as well as to hit your calories as well.
Yeah,
that's where
it's a lot of strategy.
Yeah,
a lot of strategy. If you're on a low carb diet, for example, you can expect that you're going to be lower in fiber, lower in several of the B vitamins, but particularly thiamine, folate, and B6. You're going to be lower in calcium, magnesium, potassium, vitamins A and E, and just generally antioxidants and phytochemicals. You're not going to get the same amount as someone who's eating a diet rich in carbohydrates.
Yeah. And like you said, for overall hormonal function, zinc, especially it's popularly associated with testosterone and overall sexual hormones in general, sex hormones in general. And like you said, if someone's trying to, okay, I'm going to get big or I'm going to maintain my muscle while I lose fat, if you're not getting enough zinc in, your testosterone's going to be shit. And then leading on, that's going to contain a lot of problems with your libido.
The thyroid as well. Zinc's huge for the thyroid. Yep.
So again, it's kind of something people forget where you're like, your thyroid needs all these essential vitamins and minerals as well.
Yep.
And everyone's always worried that they have a low thyroid function. Well, they're not looking at kind of the minerals and vitamins that allow it to function optimally.
Yeah, I mean, a lot of these deficiencies, iron and zinc are really important for the thyroid. If you're deficient in them, that can cause your thyroid to function at a suboptimal level. Yeah. So.
And again, relating back to, thyroid, calorie burn. So your calorie burn is going to go down.
Yeah.
So all these things.
Yep. And
again, people kind of complain then, hormonal function is off. Well, you're not giving your body the actual vitamins, minerals for your hormones to work properly. So it's a chicken and egg scenario.
Yep. Especially on a low carb diet.
Yeah. Well, a few years ago, and that was popular. When everyone fell into, I was giving that to my clients.
Do you mean a few years ago? I still have people coming to me cutting out carbs.
No, but I was at probably 10 years ago at this stage when it was more popular. Yep. But again, after I learned, they were like, all right, the amount of B vitamins, as you said, that you're cutting out, which can relate to all the stuff, energy, etc. We're like, oh shit, okay, that was a bit dumb, but that was all we knew at that stage. But yeah, for those that think that is a wise decision, it is not.
No.
We'll talk about some of the B vitamins after, because I know I got that tested and there's a gene related to that, so we can talk about that after. But The third one, you mentioned vitamin D, was it?
Yep.
Ironically, obviously being in Australia. But still, it doesn't really matter here because I've referred people out and it's still the same way because...
Yeah, well, I guess, in Australia here, the sun's a lot stronger, so we're worried about being sun safe.
Yeah.
Which, being really sun safe, and I'm not trying to say that you shouldn't be.
Yeah, no.
But it can influence
That's the byproduct.
Our vitamin D levels. So,
especially even more being locked down.
Yeah. Yep. Lockdown would have been a heavy hit to vitamin D levels.
I'll have people still. I think I have one client. Again, in the middle of the desert, Dubai, San Fran, and they're still vitamin D deficient. Again, just because of staying in all these P times where you can get a bit more vitamin D, where it's a bit more bioavailable.
Yeah. It's just about being sensible, really. Like, if it's the middle of summer, well, probably don't go outside to get your sun exposure at midday.
Yeah.
That's just stupid. In winter, it's a bit different. If the UV index is 3 or below, well, then, yeah, you should probably be out in the middle of the day. Try and get your arms and legs exposed if it's not too cold. But, yeah, in summer, be sensible about
I know that when I went to get my skin checked here, I just said to the guy, look, when's the best time to go out when it's hot? He said, there's an app you can get on your phone where it says the UV.
Yeah. Well, on your iPhone, it has a standard on the Apple weather app. Yeah, okay. It'll have the UV index.
Yeah.
So just check where it's at.
And this was obviously a massive thing. A lot of the listeners to this are England and Ireland, where you're just like, Jesus Christ, like the amount of people that are vitamin D deficient over there. And vitamin D is a special one because it's kind of like acts as a hormone, right? It's like
it's a pro-hormone.
Yeah.
Yeah.
And is it right saying there's like a receptor in like nearly every cell of your body? That's how important.
Yep.
A big thing probably people talking about these days related to COVID, where they're like looking at how big, or looking at the correlation the country's doing well with COVID and vitamin D, and I think there's a lot of doctors. Dr. Rhonda Patrick put a heap of studies out, meta-analysis about that, and we can see obviously Europe's getting hit a bit harder, and a lot of people are locked up on the vitamin D deficient in relation to obviously how it's protective against respiratory, which is for someone smarter than me to explain, but it's related to your immune function, right? It stimulates, is it like the white killer cells or the white T cells, something like that? You need it.
Yeah, once I see my clients coming in with recurrent infections or just generally poor immunity or autoimmune conditions as well.
Interesting.
First thing I'm testing is vitamin D.
In relation to people getting sick, I don't think people, like I've had clients, again, more, actually it would be all these things together, clients get sick every like 4 to 6 weeks. I'm like, you're not meant to be getting sick that much. Like, that's not normal.
That's not normal.
More for clients I'll see face to face, and sick again could be stress related as well, but then it's a double whammy because then you're vitamin D deficient, you're zinc deficient, two of the more prominent ones when it comes to your immune system.
Yep.
So yeah, that's such a massive thing as well when it comes to that.
And vitamin D, it often, if you are deficient, it often won't present with symptoms, or
interesting. Yeah.
Those symptoms may not be totally clear. If you're really in tune with yourself, you might notice fatigue, bone pain, weakness, especially mood changes for those who are really in tune with their mental health. But poor immunity is a big one.
Yeah, and especially, is it right to say then, people getting older, especially where they're worried about brittle bones, and you're like, well, you need vitamin D for calcium absorbers, isn't it? Like,
you do. And so vitamin D deficiency predisposes you to osteopenia and osteoporosis. And
again, like you said, people who may not know this, where you might have a GP where you're going, okay, you're getting a bit older, here's a calcium supplement. And again, like you said, the matrix of the minerals and vitamins, they interact with each other. Well, you need this supplement for the absorption of this, magnesium, vitamin K, all these kind of
It's all intertwined.
Yeah, it's all intertwined. So, and vitamin D is such a massive one. I see with nearly everyone that I've got tested and sent to someone that, I need vitamin D.
Yep.
And again, like you said, where it's hard to give out the recommended dosage because you might have severe inadequate levels of it, so you need to take more, blah blah blah. It's going to be different for everyone.
Yeah, the dosing is definitely different for everyone. Like, I've had clients before where I've put them on an acute dosing phase of 10,000 IU per day for 3 weeks to get their levels up quickly, and then have tapered it off after that to a maintenance dose. Some people will just start straight off on a maintenance dose and see how they go.
I think that was the thing they're talking about regards COVID as well. They're like, okay, it's good that we know vitamin D can potentially be protective against, but you're like, well, there's no point in you taking 5,000 IU if your levels are down the drain, because you're not going to hit the sides. You need to have a look where your levels are currently at.
Yep, you need to get
them
tested.
Up to standard then, and then that's going to be more protective rather than just taking randomly vitamin D supplements.
Yep.
And the same way, obviously, if your levels are already good, it could be potentially damaging you taking a massive super high dosage as well.
Yeah, like, there's no benefit to taking more than you need.
Yeah.
That's been investigated in some studies, especially for athletes with vitamin D. You know, there is no ergogenic benefit to taking more than what's required, or maintaining levels above what's optimal.
Yeah, so get that tested. And again, even more so, we're sitting here with obviously pale skin, so we're going to probably absorb it a little bit quicker if we're in the sun.
Mm-hmm.
But then when you look at people with darker skin, not only over here, but like in the midst of the UK or Ireland, like if you've dark skin, you're going to be even more deficient. So all these things you need to look at. And if you're going to get sun exposure, obviously see where your levels are at to be able to advise from that, or you may need a bit of both supplementation.
Yeah, and when you are getting that sun exposure, like, you know, I know it might be hard for the listeners over in the UK, but try and make sure your arms and legs are exposed. You can handle the cold because...
And it still comes through on a cloudy day, isn't it? Like, you'll still absorb some vitamin D when it's cloudy.
Definitely.
So get out there,
Definitely.
Excellent. Okay, so they're the three main ones. Again, obviously go get tested, but hopefully some signs and symptoms when it comes to that. So what other areas you're kind of looking at? You were talking about women's health.
Mm-hmm.
What are some of the common things you see women, I don't know, do wrong with their health, or what could they do better? Obviously, in terms of diet, and you looked at severely under eating, which again people associate with weight loss.
Yeah, and sadly, it's way too common. You know, majority of my female clients who come to me aren't eating what they need to be eating, and you know, that's just because diet culture has been in our faces 24/7 for as long as we can remember, and it's ingrained in our minds, and we're basically conditioned to be fearful of food as females. Reality is we actually need a lot more than you realize to function optimally. So it is a hard task trying to get some of my female clients to be where they need to be with their intake. Sometimes I have to be a little bit sneaky about it, but...
And this is not to say, like, if you're fucking 50 kilos overweight, we're not saying you're massively under eating. You might be eating the wrong stuff, like, but overall, calorie-wise, you may at some point be binging and restricting and whatever.
Well, I mean, even if you're 50 kilos overweight, like, there's still a line where that calorie deficit is way too big. And, you know, I have seen overweight clients who come to me and they've got, you know, gut issues or hormone issues or something like that. And then when I look into their diet, they're trying to live on 1,400 calories a day. And then, you know, like you said, that prompts that binging, restricting cycle.
The wrong shit.
But once that's addressed and you can get them to a point where they're eating what they need to be eating, whether it's maintenance or, you know, a more modest deficit, quite often a lot of those issues resolve themselves.
Yeah, it's going to be intertwined, as you said, with energy and all
and
this kind of stuff.
Just a lesson to women. It doesn't matter, you know, what your size is. A lot of us are just not getting what we need to.
Yeah. And again, that relates back to the other episodes we look at where, like, all right, how to actually set up to be consistent, because what you said is people are trying to go mad drastic. Then they're eating the wrong stuff and they're not eating enough of certain foods, and then that's going to lead to all these health problems, and then they binge out and then go back to the start and then continue. So throughout this whole cycle, they're never eating any much nutrient dense foods at all. So
no, and that's again something I relate to diet culture. You know, there's all these like low calorie versions that sometimes are not even that much lower in calories. It's all just, you know, marketing really. And people kind of obsess over them sometimes, and they're ultra processed foods. Like, yeah, you might not be eating Macca's, but it's still an ultra processed food. And it's kind of like, take it back to basics. You know, focus on getting your 2 and 5 every day. Focus on variability. Focus on getting enough fiber and eating a diet that's rich in whole and minimally processed foods, because not only is it better for you, but, you know, for someone in a calorie deficit, the worst thing is feeling hungry. I think that's probably my least favorite part of calorie deficits. I hate feeling hungry. If you're getting all those things and you're getting enough fiber, you're getting enough protein, well, that's going to increase satiety. You're not going to have to deal with that constant hungry feeling that drives me nuts in a calorie deficit.
Yeah, I think the problem is people, if they're trying to achieve a calorie deficit, for the first few weeks, they'll probably be all right. They're like, all right, I can fit all these kind of processed foods in. I'm tracking it. I'm losing weight. But then it's like when they hit the stage where the hunger starts to creep up and they don't have enough filling foods in there, that's when they start to go crazy and binge out. And I always, I don't know how many times I've seen that. Like, and that's the problem where people are kind of, okay, it's good that we understand why we're losing fat. You're losing through a calorie deficit, but you still, for being able to stay in the game long term, to lose fat and to maintain your results, whether you start on more processed foods, track your calories, but then work towards getting more foods in there.
Yeah, like it's not just about a calorie and a protein target. And that's what I see so much if I'm scrolling my social media feed, and, you know, all these PTs talking about A, the calorie deficit, and B, hitting your protein target. Well, you know, it's bigger than that, unfortunately. It's not quite that simple. And, you know, making sure you get enough of those micronutrients is going to help you build muscle, maintain muscle, stay healthy. Like, if you want to build muscle and you want to be healthy, well, yeah, you've got to look further than just your calorie target and your protein.
One place I'll see it massively is, again, like you said, women are probably a bit more susceptible to going too drastic calorie wise, and then because their menstrual cycle and stuff as well, they require more nutrients in general. Is you may see like your favorite Instagram Fitspo person and they're training for the arse and they're always shredded, but again, doesn't mean they're healthy. Like with all these, as you said, hormonal function, nutrient deficiencies, you don't know if they're actually healthy in regards to all these things.
You only see what they want you to see.
Yeah.
And that is them looking lean and shredded and in beast mode at the gym. But yeah, a lot of the time they're probably not that healthy, really.
Yeah, and I've seen it where okay, that you look on her Instagram, looks great, but again, she's still posting pictures from last year, and I've seen that she's ballooned out. Your body will always fight back and cause you to binge out, and I hope you're going to get all these nutrients and calories back up.
Yeah, if you don't address these things, your body will force you to address it.
Someone's losing fat, they're going well, they might have blood tests, basic panels, they've covered all the bases. What other aspects do you then look at? We can look at for overall health. Digestion, obviously a big one these days, for all the many reasons that may be the case. Stress, people are eating too quickly, all this kind of eating when they're busy.
Yep.
What are the other kind of pillars that you'll look at with someone to make sure overall they're living well and the good quality of life?
Like the basic pillars of health I look at, your sleep.
Yep.
Sleep's a big one. Are you getting not just enough sleep, but is it good quality sleep as well? Other things, like you said, stress levels are huge, and not just, mental or emotional stress, but, stress from training. Stress comes in many, many forms. A hypocaloric diet is stress.
Yeah, it's a stress, yeah.
So, stress is multifactorial. So I'll look at all the different factors that underpin that. Other things that I look at, really basic stuff that people just neglect, like your 2 and 5. Are you eating enough fiber? Are you eating enough protein? Are you exercising every day? Like, people just aren't moving. Or, they're ruining themselves in a hardcore training session, but then they're not moving outside of that.
You see, that's when I think of more the under eating. I think more of especially the people that go to these more group training style classes, kill themselves every time you go, F45, all these classes, they're killing themselves, eating very little calories, probably function on adrenaline and stress and caffeine all day. And then by the time it gets to Friday, you've just under eaten so much, you're going to binge out. You do that all weekend, probably through shit quality food, and then you start again on Monday.
Yep.
Trying to restrict yourself.
Yep. It's a vicious cycle.
Yeah, that's the one I see more.
Yeah. It happens a lot. I definitely see that as well.
And like talked about before, then will vary, but sometimes actually doing less, you're going to lead to better results. For the reasons that you said, it's less of an exercise of stress, big calorie deficit stress.
Yep. Yeah, I think a more modest deficit is a much, much better approach, in my personal opinion. And clients, in my experience, prefer it.
Yeah.
They're not going to get results as quickly, but they're going to get results that are more sustainable. Their health is going to be better in the long run, and they're not going to have that vicious cycle of binging and restricting. And they can still include foods that they enjoy, and that's really, really important. Regardless of where you're at, whether you're trying to lose fat, gain muscle, you're in a surplus, whatever, it's really important that you enjoy what you're eating.
Tell us a bit about from your own point of view, what, because you had a mad transformation.
I did.
As well. Tell us some of the mistakes that you were falling into. What would you tell your former self if you were training her, if you were advising her?
Oh God, isn't that
because
a wormhole?
It's common one that a lot of people will make, especially girls.
Yeah.
Not for your own fault, just stuff you fed into. And again, I had one of my clients, Emma, on as well, and she was like, "Well, everyone always tells me to train hard, so of course I'm training hard every day, but
no pain, no gain."
Yeah, exactly. Little did she know, it's actually counterproductive to her goals. So, what kind of main ones you would tell your former self if you were training her?
Oh, that's a tricky one. I think with me, I was very much in denial about things that I needed to change. And, at the time, to give all the listeners a bit of perspective of what that transformation was like, when I started training with Sean as I was a student, I was at 82.5 kilos. And, I now maintain a weight of anywhere from 63.5 to 66 kilos. So it was a huge weight loss. It was done over about 12 months. And I was definitely stuck in that cycle. And I was very aware of that cycle at the time. But again...
Yeah, but it's hard because, again, you're seeing 8-week transformations, 10-week transformations. And that's just fucking...
And we're a generation that just wants everything now.
Yeah.
We want it now. So you go into a calorie deficit. So you're trying to get by on 1,400 calories a day. For someone who weighs 82.5 kilos, that is insane. But you want to lose weight now. So, and, for me, diet culture was long ingrained in my mind. There were some big childhood triggers there as well, which I think is something a lot of females grow up with.
People telling you stuff?
Yeah, comments about, things that you're eating. The old, should you be eating that, is a huge one for me. Even to this day,
Really?
Is still a bit of a trigger for me.
So if someone was saying that, What age are you when someone's saying this?
My dad used to say it to me when I was a child.
Oh, like when you're eating the quote-unquote like processed
Like if I got a
foods?
biscuit out of the pantry and my dad would come past, he'd be like, should you be eating that?
Yeah. So what, then you wanted it more just because someone's...
Well, I think then it forces you... There's a shame factor there. And so you start to do things like you start to eat in secret.
In private, okay, yeah.
And eating a snack in secret evolves to binging in secret and hiding food. And that was something that I also struggled with for many years too.
Yeah, it's not all the things people say.
I don't know if that's gone off a bit off the track.
No, that's good. Because again, when I talk to Louise, cultural thing, people say different stuff. Coming from a background where her mother's from Poland, communism, where you don't get much fucking food, it's like you better finish everything on your plate. And then what that's doing is you're kind of stuffing your hunger signals up because like you're eating past the point of when you're full.
Yeah.
And then what does that do later in life? Well, you don't know when you're full, so you just keep eating until there's nothing left on your plate.
Yeah, and as a kid, you know, not being able to leave the table until your plate is clean kind of thing. It's kind of like, well,
same thing.
what if you're just not hungry anymore? And like you said, it's important to recognize, you know, hunger satiety signals. Another thing, you know, that I notice now, especially now I finished my degree, I'm a clinical nutritionist, I'm treating clients, is as a nutritionist, people are like, oh, you eat pizza? Or, oh, you eat burgers? Or you go out and party on the weekends? And it's kind of like, I first experienced that years ago. I used to be a group fitness instructor with Les Mills. So I was teaching body attack, and I would pass some of my participants in the grocery store, and they would kind of look into my trolley and suss out what I had in there. And if I had a pack of Tim Tams or something, it would be pointed out, which is a huge trigger, but it's really important.
So that was triggering even what your dad said then?
Well, yeah, again, it goes back to the should you be eating that?
Yeah.
And it's like, well, yeah, this is what I want people to learn, people to understand now, is that you need to enjoy what you eat. The old 80-20 rule, you know, everything in moderation, all that sort of thing, is you should always have foods that you enjoy. It's just... Yeah,
well, the net profit overall health of the happiness, but then like you said, where you learn to eat these foods in control, so then you're not going to want to binge out on them altogether.
Yeah, so now, I have no problems eating a pizza on the weekend, or, you know, enjoying some of my favourite chocolates, because...
So before you would try to restrict these foods, that, or if you're trying to lose fat, like would you try to not eat them at all?
I would try to not eat them at all. If I did eat them, you know, if I was living with housemates, for example, I would eat them in secret.
Really?
Yeah. And there was, you know, a huge shame factor there for me. I know I'm fat.
Yeah.
So I can't be seen to be eating this because I'm trying to lose weight, kind of thing. Or...
Yeah, I think a lot of people fall into that. Phil Ernie always talks about where he's like, you're afraid to tell your friends you're trying to lose weight because, like, fuck, how many times have you tried to lose weight? Like, this is the 20th time. So then, instead of ordering the salad, they're just going to order what everyone else eats because they're too embarrassed to say in.
Yeah. Yeah, and there's a connection thing there as well. Like, you want to enjoy the foods that everyone else is enjoying.
Yeah.
You know, food is such a huge part of human connection.
But even on your part, it's actually very important, and to go for your own transformation, because I'm sure it serves you now, helping people. Because a lot of the stuff you probably did, you're like, well, now I can recognize that in clients. Even with even trainers, the best trainers always get people to train them because they learn stuff from. You have to go for your own transformation, because what happens, it's commonly seen, is you'll see all these people who have never been out of shape at all, then giving advice to people. They don't have that level of empathy at all, and then that shows you, well, it's just calorie deficit, just eat like that.
Yeah.
And this trainer's never been fat in your whole life. Like, you don't know the struggles and the mechanism and all this stuff that's going on. So I'm sure
that level of compassion is really important. And, you know, especially when you have, like, I see female dietitians, for example, being like, making blanket statements like, women need, you know, minimum 2,500 calories a day to function. And I kind of sit there and I'm like, you clearly have never had to go through the struggle of losing, a serious amount of weight. And, there are changes to your metabolism.
Yeah, 100%.
And, while reverse dieting is great, you can try all those tactics, they've never had to go through that. And that statement can be really stressful for someone who is currently trying to lose weight or someone who has lost 20 odd kilos.
Yeah, it just confuses you, doesn't it?
Yeah. It's stressful.
And it's the same with trainers giving out advice where they've only ever been the same. So again, you don't have that level of empathy to be able to give it. What I did want to also talk about, I'm not sure how they obviously teach nutrition, etc. But do you think it's important that you got, in regards to your own transformation, looking at calorie intake as well? I don't know if that's more dietetics or the difference between both, but you've the best of both worlds now, where you've kind of learned about calories through your own journey, and then you can combine that with your nutrition knowledge as well, where I think sometimes it's too much purely calories and you're not looking at nutrition health as well. So it's a nice little combination. And the way we were talking about before, between adding those foods back that in the past you have eaten in private, how did you go about adding that back? Was it a case that, like, would you track your calories? Would you weigh those foods out? How do you get that control back personally? And how do you advise people to kind of eat those foods in moderation?
I think while you're in a fat loss phase, you definitely, if you are tracking your calories, then you definitely need to track those foods. And it's a good learning curve because it teaches you to realize, how calorie dense some of these foods that we love are. So it teaches you, appropriate portion sizes and that sort of thing. When on my transformation journey, when my calories were increased to an appropriate deficit, it afforded me the luxury of being able to include them in my daily calorie target, and therefore building a better relationship with those foods and a better balance in terms of the frequency of which I consume those foods. And I found that over time, I wasn't craving those foods. I also, from the psychological side of it as well, I wasn't thinking about them all the time and when I'd next be able to have them or hide them. So in a fat loss phase, it's definitely important when you're maintaining, which I think is probably harder than losing. Maintaining is definitely the hard part. It's about building a healthy relationship with, foods we love and foods we need, and, how to include them in the diet in moderation without feeling guilt or shame. That can take a long time to work on that relationship.
Yeah, I think the celebrity guy Ethan Supple, he's lost a tremendous amount of weight, but he did it properly. What's the nutrition company he worked with? Renaissance Periodization. He got like a real good coach there. I think he's the only celebrity who's lost the weight properly in a good way, and he's promoting that now. But he always talks about, like, people think, okay, when I lose 20 kilos, that's it, I'll be good. But it's just as hard staying motivated and stuff to maintain the fucking things, and like you still need those same coping mechanisms, which is why, again, losing it properly will help, like you were saying, when you're adding these foods in.
And the thing is, you're always saying this as well, but the motivation isn't always going to be there. And, sometimes it's going to be really mentally, emotionally draining or taxing trying to go on. And that applies to both fat loss and maintenance stages. I definitely have weeks now where I'm just like, fuck it. And you go down that thought process.
Well, I think it's easy to then get to that stage where you get overconfident, cocky, and then it's easy to start pulling the weight back on. Like when you're not looking some kind of measurement within it, whether, I don't know, if you're weighing, what you're measuring, if you're looking at your food, if you're not doing any of those, it will be so easy to start falling back into old habits quick enough.
Yeah, and the methods that you use need to be appropriate for the stage you're at in your life and where your headspace is as well. You know, if you're under a lot of stress and, you know, your sleep's not that great, you've got gut issues or something, weighing yourself every day probably isn't going to be great for you.
Yeah.
You know, you would be better off looking at something like your measurements. For me personally now, I no longer weigh myself every day, which is something that I did religiously throughout our time together. Just because, stress causes huge fluctuations. I also have a lot more muscle than I had, you know, than I had when I first came out the other end of that transformation. So, you know, muscle weighs more, therefore I'm going to see a bigger number of the scales. So for me to not, you know, stew over that or freak out over that, I now go by measurements. And how
I think what people do wrong is they don't use any form of measurement to maintain where they're at, whether it's a certain pair of jeans, whether you're obviously tracking your food. The problem is obviously if someone doesn't do any of that, then it's so easy to go off the wall. So.
Absolutely. Like at the bare minimum, you know, pick a night, like I have this skirt that I'll try on, and that's like, if that skirt fits me a certain way, I know I'm good.
Yeah.
And nothing else matters.
Yeah.
So like at the bare minimum, pick a pair of jeans.
Yeah, because the people I've seen who maintain a weight loss, one of the things is like they weigh daily. Now I don't think it's purely a weighing bit. It's like you need some form of measurement to keep you in check.
Yeah, definitely.
That's the thing. So whether you don't want to weigh, have some form of measurement.
Yeah.
That you refer back to. But the people I've trained and may have went off the walls, they didn't use anything. They weren't tracking the food. They didn't know what was going in, and then you're in denial about the other two things because you're off the walls. Yeah,
it's the thing you need to understand is when you start that journey, that fat loss journey, it doesn't end when you've lost the weight.
Mm-hmm.
It continues, and you know it just comes down to behavior change 101, really. You know, implementing what strategies do you have to stop yourself going off the rails so that you maintain that, you know, and that's dietary objective as well. So, you know, whether you use measurements, whether you weigh yourself or you pick your favorite pair of clothes, you've got to have strategies in place always.
Yeah, and I think even in regards, when I say fat loss, and you're probably the same thing, it's not the traditional thing where again you see people go, okay, just track your calories and just hit your protein goal. When we look at it, we obviously, if someone's goal is to lose fat, okay, I want you to lose. As you said, most people can only handle probably moderate deficit with everything else going on, but you're also looking, as the time applies, at your sleep, digestion, these nutrient deficiencies, stress levels, your training load. You're looking at like the holistic view of everything together, not just, are you losing weight? Cool, keep going. We want all of these things in check, ideally.
Yeah, I want you to be healthy.
Yeah.
No, mentally, physically, emotionally. I want my patients to be healthy.
Another thing we didn't look at, libido. Obviously, it's probably just a thing where it's mulled over a lot of time, but it's a pretty significant sign of whether you're healthy or not.
Yeah, definitely. I always ask my clients that question, how's your libido? Male or female? I always ask that question because it's such a huge indicator of where you're at with your health. Because if something's not right, your libido is going to take a hit. Yeah.
Naturally, because your body doesn't want you to evolve or to pass on your genes because you're not healthy at that moment in time. Like.
Yeah, or, you know, maybe there's some emotional or mental blocks there. Again, that's a health issue that needs to be addressed.
And the last thing, just like you touched on, we might as well take it there as well. With mental health as well, where you look at all these things, how they affect mental health. I think it's become a bit more prominent now. Functional psychiatry, where you'll look at everything. So if you have anxiety or some form of depression or anywhere along the spectrum, go get your bloods done, go get all this stuff, digestion issues, how all that, all the research is tied into both. So you're looking at that, and you'll obviously refer out with needed. But ideally, overall health, if you were seeing a psychologist or whatever it is, you still need to get all this stuff.
Yep.
Because of the link, the ever evolving research and the link between the both of them as well.
Yeah, and the reality is that for a lot of people, managing their health requires a multidisciplinary team.
Yeah.
And that might be your psychologist, your nutritionist, and your PT.
Yeah.
Unfortunately, it's not within anyone's scope to address all three on their own. So if you're really serious about it, then yeah, you need to employ, one for each aspect.
Yeah, and I think that's what people are kind of... One thing where they improve, where you have certain specialists in certain areas, well, the problem is they don't talk to other specialists in other areas. It's like, it's the same anything. You go to a knee specialist, well, if it's your fucking hip or ankle's the problem, you're looking at the whole picture as well. Yep. And that's the same with your health. So, yes, that is brilliant. And what else have you been up to lately? You obviously just launched all your website, taking clients on.
Mm-hmm. My online booking platform is up and running. So
if people want to find the website for that.
If people want to find the website for that, it is fuelednutrition.com.au. Otherwise, my Instagram handle is fuelednutrition_. And I have a direct link to my bookings page in my bio. Have a look at my blog. I've got some really interesting posts on there. Got some exciting things in the pipeline. So, and
it's funny, people, I think when they think nutrition, they just think, this person's going to tell me to eat more veggies, or or tell me exactly what to eat, regards just give me some cookie cutter meal plan.
Yeah.
But like we said, you're looking at all the aspects we talked about of all the parts of quality of your life, and obviously how food interacts with that.
Yeah, I generally don't like to give out meal plans.
Yeah.
In my experience, I have done them previously. In my experience, I think that they're not sustainable, and we're human, which means that, a lot of people don't like to be eating the same thing day after day or week after week, and we like a level of spontaneity or being able to engage socially, which often involves food as well. So it's about teaching people how to be able to enjoy those things in a way that will support their health and their lifestyle and their goals.
Yeah, and I think that's another thing where your own journey probably afforded you those skills earlier on, where most people probably qualify, they probably take a few years to learn that. They go, well, why the fuck's I'm following this stuff that I give them? How the mental aspect of fat loss or health and behaviour change, how it's so interlinked, and just understanding both and trying to get that sweet spot between both.
Yeah, and that sweet spot is going to be completely different from person to person.
Yeah.
Some people thrive on, really rigid, regimented sort of plans and strategies, whereas some people need a lot of flexibility, or they just, it's out the window.
Yeah. Yeah, that's all. Yeah. Strictness and autonomy is a fine line.
Definitely.
Where I think, and that's the term where people go, okay, just hit a calorie deficit. Someone goes, no worries, I can eat whatever I want, starts to track their calories, and they're blowing the calories out by midday just because they have no structure, whereas traditional diets, too regimented. So you're getting a fine line. And what else is going on? You're just taking clients at the moment.
I am.
Go check out your Insta, go check out your website, see what else you're up to. All the great photographs. That's the reason she's going out with a photographer, just to put all those good photos up on our Insta website.
It's good having a photographer boyfriend who can follow you around some days.
Yeah, go check him out as well. But no, that's brilliant. It's great to chat. We'll definitely get on in the future. And yeah, thank you for coming on.
Thank you for having me.